Good afternoon, friends. Today I will share 5 ways to reduce an enlarged prostate gland. This is a crucial episode for those diagnosed with this condition. I very often see this diagnosis in ultrasound results, and unfortunately I see that many people are being misled. This episode will be very useful for you because even if you don't have this diagnosis today, one day you will remember the information I share with you today, and it will be impossible to deceive you. You'll clearly understand what's necessary, what isn't, and which medications people are pushing that you definitely shouldn't take. And there are certain methods of actual treatment that will either be indicated for you or not. If you watch today's episode until the end, you will be able to perfectly understand your prostate and the methods of treatment. At the end, I will definitely tell you about natural ways, as I promised, about how you can naturally improve the health of your prostate. And we will also go over the main questions that you often ask me on my social networks. Well, let's get started. A classic picture. A person comes to see me, brings a report. I ask, what is bothering you? He says, my prostate is enlarged. I say, stop. What is bothering you? Any complaints? This is the main criterion. Why? Because you need to treat the person, not the paper. And if simply having an enlarged prostate was the main criterion for needing treatment, then probably 2/3 of the people walking down the street could be grabbed, given an ultrasound and told, all of you need surgery. That's not the main thing. First of all, very often, I won't use any strong words. They deceive, but apparently they're mistaken and make a diagnosis that actually isn't there. You need to know the exact size of your prostate gland. First of all, they are different at different ages, and everyone forgets about that. At 15 to 20 years old, it will objectively be smaller than at 45 to 50. But for some reason, everyone looks at a person who's 50 plus, and they start looking for an adenoma there. And the most important things you need to know. First, sometimes the prostate is not enlarged but reduced. If your prostate is 10 to 12 cubic centimeters and you're a grown man and at the same time you have trouble urinating, then this is prostate sclerosis. Reduction is something that is probably missed in 98% of patients. They come in with prostatitis symptoms and say, doctor, I can't urinate normally, I have a weak stream. If you have a weak urine stream but your prostate is not enlarged and you are diagnosed with prostatitis, remember that prostatitis cannot weaken your urine flow. If you have a weak urine stream, most likely it's sclerosis. If you notice the gland has shrunk, avoid any urologist who diagnoses it as prostatitis. In some cases, the text is not shortened but lengthened instead. Well, it's approximate because just like everyone has different arm lengths, everyone has different eyeballs, and the prostate is different for everyone too. If we're talking about a guy who's about 1 meter 50 and an uncle who's 2 meters 5 centimeters, well, it's probably logical that their stomachs are different sizes and their prostates are different sizes too. That's why it's very important to know the dynamics and to act. Never wait until you're pressed and you're only 25 years old. Do your first prostate ultrasound. When everything is fine with you, you know your size. Physiologically for you, this size can really increase with age. On average. Yes, just like with weight, on average it's about 25 cubic centimeters. 25 to 30 is normal. Anything more than that? Yes. It can already be considered hyperplasia. In other words, it's called benign prostatic hyperplasia. Benign prostatic hyperplasia, meaning an enlargement. People often say they need surgery based on what a doctor told them. I ask, based on what? Well, it's enlarged. That's not a criterion. Remember, size is not a criterion. So what is the criterion then? If the gland is enlarged, and for example, it needs to be operated on, it's the symptoms. The main thing is the symptoms. First, if you have residual urine, meaning you had an ultrasound, then you went to urinate, came back, and the volume of residual urine is more than 50 cubic centimeters. 50, or let's say 100 or 150. This already means that the outflow is very poor. The second thing is poor quality of urination. There is a study called uroflowmetry. It's an electronic pot that you need to urinate into to measure the flow. If a doctor tells you that you need treatment but hasn't measured your urine flow and suggests surgery, please leave the office of such a specialist. He is not a very good specialist. I'll explain why. It's very simple. Sometimes the prostate is small, but the middle lobe is pronounced, and it presses against the neck like a valve, causing a lot of discomfort. But sometimes the prostate is huge, 60 to 80 cubic centimeters, but it grows in such a way that it doesn't cause any discomfort for the person. He has a good stream, he's 80 years old, and the growth dynamics will most likely not require him to live long enough to need surgery, so he doesn't need to be operated on. Size isn't the only factor. If size directly correlated with worsening symptoms, then bigger would always mean worse. It exists, but that's not always the case. Sometimes there's this nasty thrombus, you can see it clearly on the ultrasound, it's pressing right into the neck, working like a valve. Sometimes it even comes loose. After the surgery, they removed the side lobes, but in the middle, they forgot to remove this nasty middle lobe, or it slipped out. After the surgery, the patient's gland shrank by 60%, but they're still suffering, and we need to remove the glands again. That's why the main criterion is the quality of urination. And 3 questionnaires, International Prostate Symptom Score, which I've posted more than once on my channel. The link to the Telegram channel is under this video. This is a questionnaire that you fill out and with which you can clearly understand at home how severe your urinary tract problems are. So there are questions there that you answer and you collect a certain number of points. And you can assess for yourself how effective the therapy is going overall, because you can fill it out before treatment and fill it out after treatment and see your progress. Things can get hazy in your mind and you may not always recognize when you have an issue. Adenoma or enlargement often develops slowly over a long time, leading men to believe everything is fine when they can still urinate without difficulty despite the condition. I say, well, let's do a uroflowmetry. They do the uroflowmetry and the flow is 4 or 5 times worse than it should be. I say, how come? Listen, he says, well, yeah, it seems like there's nothing wrong. And when in the end we still do surgery in some cases, for example, he says, now when I pee, I could break the toilet. They already understand in comparison how badly they used to urinate before. There are different ways to treat it. So you've been diagnosed with an enlarged prostate. How do you treat it? Well, of course, surgery is performed when there are no alternatives left. Remember, surgery is the last resort. That is, at first we always dynamically monitor the presence of an adenoma, and it doesn't mean that you need surgery. So, the first option is to do nothing. If nothing is bothering you, do nothing. The second option is medication therapy. What are the 5 types of medication therapy? The main thing is, if you do have complaints, it's alpha blockers. I'm intentionally not naming the medications, but you can find them by this category. This way you won't suspect I'm advertising. Alpha blockers are medications that don't actually treat anything, but they do improve the quality of urination. If your gland is enlarged and that's why you're having trouble urinating, then an alpha blocker can help you urinate normally. It does have, in fact, not side effects, but rather, let's say, consequences of use. While you are taking this medication, you may experience retrograde ejaculation. What does that mean? It means that during intercourse, the semen will not come out, but instead will go into the bladder. And then, when you urinate, your semen will come out together with your urine. Once you discontinue the medication, everything returns to normal. Some of the alpha blockers can also lower your blood pressure. Sometimes, by the way, some patients specifically take non-selective alpha blockers. Some are more modern than others, and if they have hypertension, they also lower their blood pressure as a bonus. Second, remember, yes, alpha blockers, but they don't actually treat anything. This is symptomatic therapy. There is one important pitfall here that you should know about. Sometimes patients come in with advanced glands. What does advanced mean? Very large in size. And this happens because they have been taking alpha blockers for 10 to 15 years. And this allows them to grow the gland to such a size that even with the medication, they have a very hard time urinating. When they come in, we have to surgically treat larger glands. So, even if you've started the medication, you still need to monitor the gland's size. Second, the gland can be reduced. Really, it can be reduced, and it's not always surgery. There are therapeutic medications. These are drugs that act on the hormonal level in such a way that the gland begins to shrink. In what cases can this be used? In cases when you don't want surgery, in cases when there are contraindications to surgery, for example, age, or it's not possible. Or if the person has recently had a heart attack or stroke, and they are told that surgery cannot be performed for the next 6 months. An option exists when possible. When a person, for example, wants an endoscopic or laparoscopic surgery, but the gland is too large, so they need to reduce its size before the surgery to make the operation easier. We also use this at times, without mentioning specific medication brands. This group is called 5-alpha reductase inhibitors. This medication works in a very simple way. It basically reduces the effect of dihydrotestosterone by lowering its concentration specifically in the tissues. That is, it decreases the amount by acting on the enzyme that helps it form. The third medication, you probably didn't expect to hear about here, but it's a medication that you may have often heard someone takes to improve their erection. Yes, that's right. These are phosphodiesterase type 5 inhibitors. I'm not giving any brand names, just the group of medications, so you can draw your own conclusions. This medication, in addition to improving your sexual function in small doses, will also help improve blood circulation. And because of what you start urinating better, the swelling goes down, blood circulation improves, and you actually start urinating better. But again, this is a conditional treatment, so you always need to monitor the size of your prostate, no matter what treatment you are undergoing, so that you don't let the growth progress to the point where surgery is needed, and it turns out you should have had the surgery the day before yesterday. Anti-inflammatory therapy. These are standard suppositories, any anti-inflammatory suppositories, including, by the way, those with natural components, so they don't necessarily have to be synthetic. Well, for example, I don't want to mention any names, but in general, you often see them advertised on television. Those top 2 or 3 brands are the main ones. Most often, these are not medicinal drugs, but rather herbs that help reduce swelling.
Can you actually cure something with them, or do they just temporarily relieve the symptoms?
Look, the gland has one particular feature. First of all, it tends to swell more by the evening and during the night. It is believed that due to prostatic stasis, that is, venous congestion, the gland can increase in volume by 20 to 30% in the evening. That even happens sometimes. Treatment, in fact, real treatment, is only with medications that reduce the volume. A 5-alpha reductase inhibitor targets the root cause, while other treatments only address symptoms. The gland is swollen, it's enlarged, and you started taking a herbal-based medication. It doesn't matter, the swelling goes down, decreases, but the adenoma doesn't go anywhere. Why do these people often say, for example, yesterday they drank with friends and suddenly felt much worse? Everything that happens suddenly in your body, remember, anything that happens abruptly is most often associated with inflammation. If suddenly, over a week or 2, you think the gland has doubled in size, they come and say, the adenoma grew by 30% in a month and it became hard to urinate. It can't grow that fast. A sudden increase in prostate size is likely due to swelling and congestion. If you notice a rapid enlargement and symptoms, it's probably just ordinary swelling, which is a significant factor. This is exactly the case when using medications that reduce swelling and improve blood circulation can help you get rid of your symptoms. Urologists often overlook this. They see an ultrasound from a month ago where the gland was 35, and today the patient comes in and it's 60, and they ask, oh, is it enlarged? Yes, it's enlarged, but why is it enlarged? A month ago, it wasn't enlarged. It doesn't grow that fast. It's not mushrooms. That's why this too. If your urologist is missing this too, please pay attention to it. Attention. Always, when the gland is enlarged, it is absolutely necessary. By the way, it's important to remember the following thing. If you are prescribed medications that reduce the prostate, this is a very important point. Very. Because of this, a lot of oncology cases are missed. They reduce the tumor marker numbers by half. There is such a tumor marker that all men after 35 or 40 take. Prostate-Specific antigen, which stands for prostate-specific antigen, is well known by everyone. But not everyone knows that when you take medications from the group of 5-alpha reductase inhibitors to shrink the prostate, your prostate-specific antigen drops exactly by half. But not because the cancer has miraculously vanished. This is how the mechanism functions. People claim they believe their prostate-specific antigen is effective. Look, it's 3, 5. I say, well, you're on medication, so it's probably 7. Let's do an ultrasound. We do the ultrasound. There's a lesion. Where was it before? But wasn't he warned that this medication reduces the tumor marker by half? And because of that, he missed cancer at an early stage and just went about his life calmly. Everything stopped bothering him. His urination got better, and he didn't really keep an eye on his prostate. And none of the doctors told him when prescribing it that he should be careful, because the tumor marker would decrease by half while taking this medication. There are also objectively real effective traumas. You know, I don't like to make things up or promote folk remedies or advertise any remedies, but there really are things that work, and those are exactly the things contained in the medications we often see advertised on television. Today, I specifically analyzed what has been confirmed by research and by my own personal experience, and what is included in the composition of many medications. Let's go point by point. First, it's our favorite pumpkin seeds. Yes, it's pumpkin seeds again. It's oil from pumpkin seeds. It is considered that 10 grams per day is the optimal dose. Second, and by the way, subscribers often ask about this. Does it work? Does it really work? Saw palmetto is a dwarf palm. It helps to empty the bladder better. It also has anti-inflammatory properties, which is good. There are suppositories that contain it, and this is the main active effect. They are sold as a medication. Third is African plum. An extract of 200 milligrams per day also helps with better urination. Babasu palm oil has been used by Aborigines for several hundred years as a treatment, especially when they had prostatitis. They noticed that this palm helps with better urination. We borrowed this from there, studied it, and confirmed it works. And the last one is lycopene. Lycopene is what is found in tomatoes, and that's why tomatoes are in the top 10 men's products, 100%. All these herbs, they don't just have an anti-inflammatory effect, they improve microcirculation. Some of them work to restore the balance of estrogens and androgens. And thus, indeed, according to statistics, they reduce the rate of growth, they decrease it, and sometimes even stop it. I'm not against what works. This works.
Are there any other reasons why the prostate might be enlarged? Because most young guys, they just don't know about STDs. They don't know.
No, STDs don't enlarge it.
But it doesn't enlarge it. If a person has a sexually transmitted disease or something hurts, stings, or moves from one place to another, then that's, well...
It's usually in the canal. And sexually transmitted infections, they're actually, prostatitis is associated with a completely different flora. Sexually transmitted infections are not really about prostatitis, actually. Prostatitis is usually caused by some intestinal bacteria, enterococcus, and so on. So it's not a sexually transmitted infection. Most often, this all happens in the canal. The prostate secretes fluid, and it all comes out in one direction. Why do men get cystitis less often than women? The infection has a long way to go from the external urethral canal to reach the bladder, and that's why men don't get cystitis, inflammation of the bladder, as often. So when I see a man and I write down that he has cystitis, I think, who even diagnosed you with cystitis, most likely you actually have prostatitis.
And about the ultrasound, there's a question. Where should it be done? Yes, I understand. There are options. Rectal and external ultrasounds. Men are often wary and afraid of these procedures.
Yes, of course. That's the right way to do it. There are two types of ultrasound. The first is called transabdominal. This is when they do the ultrasound through your abdomen with an ultrasound probe. The second type is called transrectal. This is when they have you sit on the probe. And this type of ultrasound, of course, well, guys, people don't really like to have it done. Nobody has it done vaginally. Everyone says they had it done through the abdomen. What's the point? Transrectal ultrasounds may be needed for a more detailed view of the prostate. For routine screening, abdominal ultrasounds are usually sufficient. But if we still want to take a more accurate look, get a more precise measurement, know if there are any pathological lesions, transrectal ultrasound is a more informative method. Unfortunately, but really, through the rectum, you can assess the size more accurately. And sometimes guys come in with a half-empty bladder for the exam, but it's mandatory to do the exam with a full bladder. Prostate size estimates from exams can be off by up to 2 times, with transrectal exams not matching the reported enlargement. He came in and they wrote 60, but when we measured transrectally, it was 30.
Is there any psychological advice on how to get through this more easily?
It won't be pleasant, so you shouldn't expect it to be, and usually no one promises that it will be pleasant. To make it as painless as possible, let's say, you need to lie on your side, relax and breathe as deeply as you can. That is, the more you resist, the more it will actually hurt, and the more you'll remember it. And then next time you won't want to come. If you've ever had a prostate ultrasound in your life, leave a like under this video. Friends, I have an interesting request. If, of course, you have the guts, write in the comments below. What do you think can help you get through a prostate ultrasound? Yes, to make it easier to handle, share your opinion. First of all, remember that if it's written in your fate that the prostate should enlarge, then with a high probability it will enlarge. Because genetic determinants are present here, there is a genetic trait that is passed on to you, and statistically you have a higher chance of developing prostate adenoma. That's the first thing. Second, you shouldn't be afraid of prostate adenoma because today it's all treatable and very easily. Third, it's most often treated without consequences, so you shouldn't think that prostate adenoma means disability for a man. Life after surgery is just as full and colorful as it was before the operation. Fourth, indeed, the presence of hormonal problems in the body, according to the latest data, increases the risk that you may develop a prostate adenoma. An imbalance of male and female sex hormones, and specifically a deficiency, can become triggers for this to develop in you. But the paradox is when this has already occurred. Higher levels of testosterone and dihydrotestosterone, respectively, will stimulate the growth of prostate adenoma. Be healthy?
Question. After the surgery, does the reaction always disappear?
Very good question, Sash. First of all, many people often confuse adenoma and cancer, and the surgeries for them are completely different. With the diagnosis of prostate adenoma, I always give you the example of a mandarin. Imagine that your prostate is a mandarin. You leave the peel, but you have to remove the segments from the inside. All these nerves that are responsible for our erection are behind the peel. They're right next to it. They run behind the peel, and you don't touch them. You don't remove them. But if a person is diagnosed with cancer, then the whole mandarin is removed along with the peel, and most often together with the nerve endings that run nearby. And that's when real erectile dysfunction develops. That's when real urinary incontinence develops. That is, this happens when the prostate is removed. But with an adenoma, the prostate is not removed. Dear friends, with an adenoma, the nodules interfering with urination are removed while keeping the prostate intact. Therefore, after the operation, erectile functions often actually improve, blood circulation gets better, and erectile function, that is your male strength, becomes better. You asked an important question about having children. Indeed, there can be related problems. Do you know what they are? The large gland is removed, and all of this forms what's called a prebladder. Under the bladder, a sort of groove is formed, let's say. After they do the transurethral resection, retrograde transurethral resection often develops. This is, after all, a treatment for adenoma, and it doesn't matter what type. Surgery, adenoma, prostate retrograde ejaculation often develops. That is, you have an orgasm, you feel like the semen is coming out, but it just doesn't come out the way it should. It goes out with the urine, and then you go to the bathroom and you see the semen. Here, unfortunately, either like in ancient times, you know the gesture with the finger, you know where it's from, right? Well, there are two options there. The first is when an elderly man, he could more or less manage to ejaculate, but he didn't have enough erection to insert his penis into the vagina. And he ejaculated on the stomach. And the girl used her fingers to insert the sperm into herself. And in prison, when a woman is incarcerated, sperm was often smuggled in and the woman would become pregnant. And this expression, done with a finger, this conception, when it happens because of a finger, yes, this is really one of the consequences. Sasha, didn't you know about done with a finger?
No, I guess. Does the argument help or not? Actually, to reduce this?
It depends. Look, if you have, let's say, some kind of acute inflammation like some kind of purulent prostatitis, then no physiotherapy, especially massages, should be done. How many patients were there who, after starting massage during purulent prostatitis, ended up having both testicles removed? He develops a purulent epididymitis. The infection goes down under no circumstances. And in general, massage has contraindications. If the patient has calcifications, under no circumstances should you do massage. The whole gland comes in, filled with calcifications. They tell me 32 massages were prescribed. That's why there are these videos. Never do massages when the gland has stones or calcifications. It is strictly forbidden under any circumstances. In general, I have a positive attitude toward physiotherapy when it's indicated, when there's just swelling in the gland. The same goes for massage in general. If it's just congestion, if the massage is done correctly, I also have a positive attitude toward it. Sports are crucial for maintaining good blood circulation in the pelvic region. What if you lead an unhealthy lifestyle, sitting all day at work without even getting up to do squats or walk around? Well, what kind of health are you talking about then? Everyone only thinks about their legs, about how their legs swell, that you only think about your legs, swelling forms there. But what about the pelvic plexus? That's why Kegel exercises, we filmed a video about Kegel exercises. You definitely need to try to do them. Stand up, walk around, especially if you're flying somewhere on vacation. I tell my friends, on the plane, do some squats. First of all, it's a good way to prevent blood clots. You'll feel better after the flight. Walk around, do squats, keep yourself active. And do the same thing at work. Try first of all not to let yourself get dehydrated. Try to exercise regularly. Swimming is very good for this. Do Kegel exercises. All of this will help you. This is not a cure-all, but all of this will reduce the chances that you will have problems related to prostatitis flare-ups. Thank you for watching. Subscribe to the channel and stay tuned for new episodes about men's health and more.